Hello, and thank you for joining us here on the program once again. I'm your host, Neil Howard, here on Health Professional Radio. You know, there's a nursing shortage that is expected to, intensify over the course of the next decade or so, especially as nursing schools across the country are struggling to add capacity. Now, while that's going on, Chamberlain University has found a way to add more nurses to the profession's ranks than any other schools. Dr. Karen Coxs, president of Chamberlain University, is joining us on the program to talk about the latest statistics on the current and projected nursing shortage. Tell us a little bit about how to structure a nursing program that'll not only graduate ready, prepared individuals, but also make nursing education available to more people. Welcome to the program, Dr. Coxs. Thank you for taking the time.
Thank you so much, Neil.
Now, I did say, of course, that you are president of Chamberlain University. Dr. Coxs, what is your background as far as the medical profession is concerned?
My background is in hospital operations, particularly nursing, but I was a chief nurse and chief operating officer at Children's Mercy, Kansas City, and did that for a number of years and took the role at Chamberlain last year. So it was a big change, but I had a couple of good reasons why I made that change specifically to Chamberlain.
And what was the most, outstanding reason?
The biggest reason is that Chamberlain, at its 22 campuses across the country, where we have BSN programs, 50% of the students are of a underrepresented minority. And in fact, we graduate more underrepresented minority nurses than anyone else in the country. And so I'm very proud of that. And we provide access, and we all know that health equity is really important, or health inequity. And we know from the research that if you have people who don't mirror the demographics of the population caring for you, disparities will continue and will be an ongoing issue. And so that we're able to increase the diversity, increase access, and thereby increasing the number of nurses being graduated every year.
This nursing shortage that's projected to intensify into the millions by 2030, is this a nursing shortage across the board where care is concerned, or is it specifically in these underrepresented populations that you mentioned?
No, it's overall, and what I would say about it is that the shortage will have some geographic differences. In the past, shortages have tended to be across the country, but there are going to be cities that do okay and places that are severely impacted. And that's going to be something that we have to really watch for to make sure that patient care is safe and we have enough outstanding providers all across the country. The other piece to the shortage is that nurses are tending to go back for additional education. And so having enough nurses who are directly taking care of patients in a hospital or a clinic is going to continue to be a struggle. And right now, about 60% of nurses work in hospitals, which is pretty low when you think about it. Probably not that many years ago, it was closer to 80%. So it's really in a specific area because nurses now have so many other options. And it's hard working in a hospital or clinic. They're stressful jobs. You work 24/7 and holidays. And so we're going to have to figure out how to better address the issues and needs of those nurses.
Well, what would you say is the biggest issue when talking to some of these nurses as to why they're jumping into nursing and then looking for other opportunities that are maybe a little bit far removed from actual hands-on care, which I would think would be the catalyst to get someone into nursing?
Well, you're right. That is it. We're a caring profession, and going through nursing school is no small task. It's very intense, a lot of science courses and clinical rotations. Sometimes, though, when they see the reality of what it's like, it's not that they don't like patient care. Sometimes it's that they don't feel like there are enough colleagues working with them to do the best job that they can. And I can't emphasize enough how stressful it can be. People, you're working 12 hours. You are dealing with people at the most vulnerable time in their life often. You are having to make sure that they're safe, that they get the right medications. You're having to constantly assess them and then be present for them emotionally. And so sometimes after people do that for a while, and then you add on evenings and weekends and holidays, they look for other opportunities. And some of them aren't as far removed as you might think. They're just different enough, and the lifestyle is better. And the pay is probably not that much different. So it's a combination of factors.
Is your approach to simply saturate the ranks with more hands-on so that people don't become overwhelmed, or is that kind of a fantasy?
Yeah. Well, one of the problems right now is so many people who want to be nurses can't get into programs because most of the programs right now at a lot of traditional schools, you have to have a 3.9 or 4.0 just to be considered. And I don't know about you, but I wouldn't have gotten into nursing school if that had been the requirement when I did it. And so what happens then is people who have perfectly good skills and commitment, dedication, ability to learn, have a 3.4 or 3.2, and they're automatically excluded. And so what we do is at Chamberlain is a more holistic approach to admissions, looking at not just their academic capabilities, but also looking at their life experiences and their persistence, and making sure that we admit students that we have every reason to think they will be successful as a nursing student and then ultimately as a registered nurse.
Why do you think that it is that there's so much focus on grade point average before nursing school as opposed to the aptitude and desire for that particular profession? What are your thoughts on that?
Well, I think it's an easy way to get what you believe. If you believe that GPA is a really great marker of potential success, then you would just go with the highest GPA. And if you have applications, 3 and 4 times the number that you have placements for, that's how you would do that. I would just say that I think in a lot of traditional institutions of higher ed in general, GPA has been a really important marker. I'm hoping that to continue to see that schools, not just nursing, but in general, continue to look at people's life experiences and potential past that GPA.
Well, let's talk briefly about how Chamberlain approaches educating nurses and getting them into the field. Talk about some of the support that Chamberlain offers them as they discover just how demanding the profession is going to be.
Yes. Well, we do a couple of things. And one of the things we do, one of the things we recognize is that only about 30% of a person's success academically is related to things like, are they ready to learn? Do they have the capacity to understand these concepts? About 70% is really the rest of their life that impacts them. The majority of our students are going to school full-time, year-round, 3 years, and many of them work full-time. And so we have to help them. The students have to do the work, but we, as the faculty and the colleagues at the campuses, wrap our arms around them, and their success is our success. It's not a situation where you just, you give them the information and either they pass or fail. We have a number of things that are supportive. One of the most important is our Center for Student Success, and making sure that it has nursing tutors and people available that can help them at the point in time when they need the help. We also look at through assessments what people's needs are and try to help support that as best we can. And I think our model of how we educate is called Chamberlain Care. It's really a culture of care. And what we're trying to do is role model as faculty and colleagues what it's like to be cared for. Nursing is a caring profession. And so that's one of the things that we do is focus that caring on the students in hopes that they see that role modeling and it carries through their clinical experience and their experience as a nurse.
Where can our listeners go online and get some more information about Chamberlain University and about the nursing profession in general?
They can go to chamberlain.edu, and they can also, I think, go to the National League for Nursing website, nln.org, and then the American Association of Colleges of Nursing is another place to get information about the nursing profession, the types of programs, and be very helpful.
Dr. Coxs, thank you for joining us on the program.
My pleasure. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.